Despite the surge, the CDC is making a major pivot in their COVID guidance. It now recommends a shorter isolation period, 5 days, not 10, for Americans who test positive for COVID. If you've just been exposed to COVID, you can skip the quarantine altogether if you have your vaccine and booster. You're just asked to wear a mask for 10 days after exposure. Things change if you're unvaccinated or if you got fully vaccinated more than 6 months ago and don't have a booster. You're asked to quarantine for 5 days on exposure and wear a mask for another 5. Dr. William Schaffner is a CDC advisor and an infectious disease specialist at Vanderbilt University School of Medicine and a friend of the network. Dr. Schaffner, it is great to see you again tonight. Can you walk us through the science that prompted this change and what risks there may be in changing this guidance? Because it seems like a really big pivot, 10 to 5, while we're seeing this spike in Omicron.
Well, James, I'm not Spider-Man. I am COVID-Man. But let's talk about these new changes that the CDC has recommended, because they really are very, very welcome. The scientific key to all this was the study that with Omicron, the period of most transmission were the day or two before you became ill, and then for the day or two, and maybe up to 3 afterwards. After that, your risk of transmitting the infection, your contagiousness goes way down. And that's where those 5 days come in. Gives you a little bit of an extra barrier, and that would make all of us comfortable then in getting off our isolation, continuing to wear our masks, but we could go back to work. And that's something that I think will be welcomed by the healthcare community, the airlines, just about everybody out there.
Can I just quickly follow up on that, though, because we did see some response from particularly the head of the flight attendants union, the biggest flight attendants union, saying 5 days is a little concerning because it's what she had seen corporate America pushing. Are you completely confident that this is science driven and it's not about businesses trying to get workers back in the workplace faster after they've gotten sick?
I think this is solidly science driven. The CDC and the president's advisors in Washington have been discussing this for some time. As you will remember, the first decision was made to let healthcare workers do that. We who go back and take care of other patients with these illnesses. And I at the time said, well, if it's true for the healthcare workers, let's expand it to everybody else too.
Yeah. So when you look at these new guidelines and you're looking at a guidance for an exposure, not if you've tested positive, but just if you know you've been exposed to the virus, now the guidelines are the same if you were vaccinated more than 6 months ago and don't have your booster yet, and if you're completely unvaccinated. Same exact guidance if you've been exposed for those first 5 days. So at this point now, should we consider fully vaccinated to be 3 shots?
Well, certainly from a scientific point of view, 3 shots is by far the best. And most of us consider the vaccine to be a 3-dose series for sure. Whether we want to label it that, which has all kinds of ramifications for changing all kinds of computer programs that are out there, including in my own institution, I think people are saying there's so much change going on. Let's not do that right at the moment. But yes, we are urging everyone to think of this as a 3-dose series.
So are we foregoing something that could be clarifying because it's going to be too much administrative work?
Too much administrative work is an understatement. It would be enormously difficult to change everything that's out there already embedded. And remember, we're trying to get some people vaccinated with their first dose, others with their second, many with their third, children vaccinated. Let's not change too many things at the same time.
Okay. Dr. Fauci now is also floating this idea of maybe we should mandate vaccines if you're going to travel domestically. Do you think that's a good idea?
I think that's a quite reasonable idea because, after all, if we're doing this now internationally, and we've got plenty of COVID here, Omicron has long since come here and is spreading widely. It's the dominant strain. We no longer have to protect ourselves from those from abroad. What this is a device to get people who are not vaccinated. That will persuade some of those folks to come on in along with the rest of us and get the vaccine if they'd like to get on that plane. We need that kind of compulsion now, I think. I know it's a bad word, mandates. We need obligations, requirements, even mandates to get people vaccinated finally, so we're all on the same page.
Well, you may not be, as you say, the billion-dollar Spider-Man, Dr. Schaffner, but you are a very valued member of our team around here, and we appreciate you being here once again tonight to kind of walk us through some of this new guidance. It's a big change, kind of confusing for some folks, and we really appreciate your guidance. Thank you, sir.
Happy New Year.